We deal with the nuts and bolts of whether it should be this drug or that drug or this test or that test, but we don't often think so much about the human cost and the impact that it will have on us as clinicians. So this was a case that was brought to our ethics committee, an elderly lady who came into A&E having collapsed at home with chest pain. She was brought into A&E and quite quickly collapsed and actually went into a cardiac arrest. So the resuscitation team were called. One of the nurses observed that the daughter of this lady had come into the resuscitation room and begun videoing the resuscitation on her mobile phone. This caused a little bit of distress from the nurse involved, and she asked the daughter to stop filming and to leave the room. The daughter became quite angry and quite frustrated at that point, and she was stating that it was her right to film the resuscitation of her mother, in part because her brother and sister were not present, and if her mother was going to die, they would wish to be part of or be able to witness their mother's dying, but also that they could have a record of what was done so that they would be able to deal with anything if something hadn't gone right. There was a little bit of a discussion following this between the nurse and the daughter, and eventually the daughter did placate, did calm down, did stop filming the event. The lady was subsequently successfully resuscitated.
After the successful resuscitation, a few days later there was a letter of complaint from the family sent to the trust. The daughter and the husband having concerns on two counts really. Firstly, that the hospital had no policy, and secondly, that the daughter in particular had felt that it was her right to video that intervention.
The fact that the daughter's recording it makes it no longer a straightforward resuscitation, and staff may not know what the policy is. There may not be a policy, and how do you suddenly deal with a situation where you're left uncertain?
I think I had a situation when I was a staff nurse, quite junior in ICU, where the mother wanted to be present at the resuscitation of her son, and he had cerebral palsy, so she had looked after him all her life, and she wanted to be with him during the last moments. And I took on myself to stand with her, talking her through the arrest. But that felt okay. I mean, people doing the arrest did feel a bit uncomfortable, but then when I said, look, this lady just wants to know what happens, but it's okay, you're doing fine. She wasn't having it on video. I think a memory is different from a recording somehow.
I would feel very threatened because the intent is very much they're looking to capture, one, to share with the family. You may understand that, although that in itself I would need to get my head around. But secondly, you know, she makes it quite clear that she wants a record of what happened in case there's anything to follow on from that in terms of complaints or litigation.
20, 30 years ago probably, somebody, a relative being present at a resuscitation would have been felt to be almost immoral, I suspect. Society has moved on. I think people are now encouraged to come into resuscitations and witness the event sometimes. So
I think that they allow us as staff to be able to look at how working within the trust and working with the cases that we're dealing with has an impact on us as human beings and how we interact with the patients that we're caring for.
I think if you sat a lot of people down in a room and said, let's talk about difficult aspects of patient care, it would take many hours to get to the point that you do with a Schwartz Round much quicker, because the opening gambit, the clinical story, the brief clinical story resonates with people. And even more so when the person telling the story is senior to them, standing up and saying, you know, that happened to me and I found it incredibly difficult.
How would I feel if my daughter was filming this? Would I want my other children to see the last moments of my life? And sometimes we can kind of end up focusing on what's going on around that. And I can completely see the daughter's point of view on this one, but at the same time we haven't heard from the patient.
You'd not have to seek permission just from the patient. You'd also have to seek permission from every member of the resuscitation team, on everybody who would potentially be on call for those emergencies.
Yeah, if someone was dying peacefully in bed, because it's all controlled and everyone's bought into it, but people in an emergency situation, especially if you're very junior, well, even senior people, don't always perform well.
the example that springs to my mind is obstetrics, where babies are being delivered, often under kind of surgical procedures where people are operating, anaesthetists are anaesthetising, scrub nurses are scrubbed, everything is happening. And I suspect, I don't know, I've never been in many deliveries in recent years, but I suspect there may be filming going on in those situations because it's the birth of a child and the record is something that people want to keep, but it is still surgical intervention that may make the team uncomfortable.
I think the point about what it's going to be used for is a very valid one, but we're meticulous these days about making records, aren't we? So that we can defend ourselves in whatever circumstances if that's subsequently challenged.
People seem to document a lot more the bad things as opposed to the good things that happen to the patient or to the relatives, not necessarily just the patient. Because obviously all people involved like to know if it's always bad, but then people expect it to be bad and then want to film it so they can prove what happened.
People have a much greater understanding of what their colleagues, the issues that their colleagues are dealing with. And sometimes it's been really rewarding hearing during a round people saying, I never realised it was like that for you.
The nurse who made the decision, we're going to stop this, deserves immense support and congratulation for actually achieving that, because making that decision in an instant when somebody's got a camera rolling, set against the fact that the complaint did come in and a group of very senior people spent a long time sitting around talking about the complex issues, shows how tricky this is on a day-to-day basis to make a snap, instantaneous decision on immensely complex issues.
And to me, she was very brave to react to that and to actually persuade the individual. I'd be interested to know how she did it, to stop filming and to put away the camera.
This example just illustrates a whole load of different situations where you're suddenly having to make a decision.
And I suppose the converse of that is that that's almost the same position that the daughter was in, that she was making an instant spot decision, that felt like the right thing for her.
I guess that's one of the reasons why it might not fit so neatly into a policy that will catch everything, because in that instance one of the variables is how is it for that individual person, which is why it's such a thorny issue, I suspect.
What the research is beginning to show for the rounds is that greater understanding for their colleagues then also spills over into a greater sense of compassion and empathy for patients.
There's a bit of me just thinks sometimes you just got to use common sense on this, and if the staff are feeling supported, it's inconceivable that they wouldn't provide better patient care.